and welcome to ESTRO 25. My name's Jo McNamara and I'm joined by fellow host Angelica Anderson. So we are here yet again it looks like the back of a warehouse, to be honest. I've only just noticed that where we've been recording it.
Yeah, it looks a bit, industrial, doesn't it?
I promise we are at ESTRO and we did pay our fees. We've not come to a warehouse and just pretending that we're here. Yeah. It's really expensive to buy our own lanyards. Anyway, I digress. I apologise. Would you like to introduce yourself, please?
Yes, my name's Charlie Martin. I'm a medical physicist at Poole Hospital, it's part of University Hospitals Dorset, down on the south coast in the UK.
What made you want to be a physicist?
That's a really good question. I loved understanding how things worked when I was a kid, and loved my passion when I was a kid was just learning about the planets, and that just led. I had a really good A-level teacher.
They're influential.
I was really torn between doing biology and physics. For a degree, but my A-level physics teacher was just so passionate we could derail an entire lesson by asking him how a refrigerator worked. So that's what that really got me
How
excited.
does a refrigerator work?
Oh, I can't remember that. No.
What is your day-to-day like then as a physicist?
So I'm part of the treatment planning team. So we look after, I look after the team that do our treatment planning. So when patients come for their radiotherapy, they have their CT scan, and that comes to us to create their personalised individual plans for their radiotherapy. So we work really closely with our consultant colleagues and with our radiographer colleagues to create plans for them.
Can I ask, how did you go from being a physicist to then working within radiotherapy? Is it something that you'd always had aspirations to do? How? Because a lot of people fall into it. I'm intrigued.
I had no idea it existed when I started my physics degree. As I said, I loved biology. I did that at A-level and nearly did a biology degree. So then during my undergraduate, we had a medical physics module that staff from the local department came in to teach, and we got to go into the medical physics department, into the radiotherapy department, and that was how I found out that it was even a career and about the training routes into it.
So what are you doing here at ESTRO?
So I'm presenting, I've got a poster of the very first results from my research project that I'm undertaking. So I'm on a doctoral research program called the HSST, and I have got the first results from a patient survey that I did that's fed into the work that I'm now doing.
What is it all about? What are you hoping to find out?
So it's a very non-physicsy project. It's a little bit unusual, and I'm looking at whether an additional appointment with a physicist, so an additional appointment for patients with a physicist, lowers anxiety when they're undergoing their radiotherapy.
So I think everyone out there listening is thinking, how is that going to then integrate into the work of a therapeutic radiographer, radiation therapist?
Yeah, I've had a lot of conversations with our local team when I've been talking about it, and I've made it quite as clear as I can to them that it's not about taking over from the role that the therapists have with talking to the patients. Our radiographers are great at answering the questions, and that was something that the survey I did, I asked them, if you were concerned about the technical aspects of their treatment, did you ask one of the radiographers?
Yeah.
And were you satisfied with the answer that you got? And everybody said yes. So and the free text comments they gave really supported that. So what I'm hoping to show is that there's an extra kind of I need to think through this. That there is an extra benefit for patients who want to know that more technical side, and acknowledging that our treatment staff are so busy they can't spend that time with every patient who wants to know that.
Yeah.
And also, whilst they can answer the questions, um, they do occasionally get stumped by some really tricky questions that
Yeah.
patients like to pose. Down where I work, we've got quite a lot of retired engineers that come in for treatment. Um, older gentlemen who they want to know exactly how the linear accelerators
Yeah.
work and what's going on. Um, and then on the other end of the spectrum, you've got patients who are really nervous, really anxious, and want to know just a little bit more about what's being done to them. So hopefully, I'll be able to demonstrate that the physicist has a role to play in that.
I used to love getting someone from physics to explain, because then I would also learn something new every time. Or when the engineers were stripping the machine apart, there was a patient who had a learning difference and he really wanted to know every little detail. So on the Wednesday when one of the linear accelerators had been taken apart, we showed it to him, and then actually made him a lot more relaxed for the treatment and things like that. Probably not, maybe not supposed to do that, but it really worked for him and it was really nice.
Yeah,
And
that's
obviously I got to
amazing.
learn loads. I love seeing the machine stripped apart.
Yeah. I had a scenario where there was a patient who was really nervous with their breath hold treatment that they were having for their breast radiotherapy, and the radiographers had done an amazing job with kind of reassuring her. She was worried that she was going to be irradiated when she couldn't hold her breath. And I just happened to be in the control room at the time, and could see the lady was in quite a lot of distress and starting to hyperventilate. Uh, and so when she came out of her treatment, well, they they asked, well, I asked, was it going to be helpful if I just had a quiet moment with her? And I essentially said exactly the same thing that she had already been told by the radiographers, but just being in a quieter setting, um, with somebody different, really helped her. And she stopped me in the corridor the next day to thank me, and it was a really nice moment that kind of helped reassure me that I'm not being completely bonkers with an off-piece project.
Yeah. One thing that we definitely come across with the work that we do with patients in RadChat is promoting patients to ask questions of their therapeutic radiographers, radiation therapists, and also to look at the plans to kind of get insight into, well, where is the radiation actually going? Where is it treating? Especially from a consent perspective, because obviously consent, although we've now got the national guidelines and the national consent forms, it's brilliant that helps with some kind of discussions that maybe didn't take place before, but it is still personalized, so everyone's dose is different, so the likelihood of going on to develop certain side effects may be increased in some and reduced in others. Do you think, and would you advocate for that to be part of the conversation?
Definitely, it's something that I'm planning on doing. It's something that a couple of our review radiographers do regularly. Normally when patients ask, so it's not something that's done regularly preemptively. And I think you do have to be quite careful how you present it. It can be a really scary thing to look at, and it could have the opposite effect uh, of making the patient more worried about where that radiation is going. But if you can do it in the correct way, in a controlled environment, in a quiet place, in a review room or a clinic room, then they normally find it really beneficial.
Just thinking, might be a bit off piste, but as well, you're already off piste, but just thinking of the nursing colleagues that we have who don't know much about radiotherapy, and I wonder how much this would also impact their education, understanding, and all the other allied health professionals as well.
Yeah, that's a really good point. I actually personally don't interact with our nursing colleagues at all, really. Um, so we do a lot of education, at least my colleagues do, with nursing colleagues who are dealing with brachytherapy patients, and it is something we find challenging. Um, what I'm really hoping is that uh, even if they don't learn uh, things themselves, they know that the physics team are there as a resource to be asked questions, and to go and see patients when needed. If a patient requests to see someone or to ask those complex questions, to not be afraid to come and find us, to have those conversations.
definitely helps with your visibility as a physicist as well, because a lot of patients don't understand who maybe works
They don't
on
know
their
we exist.
radiotherapy treatment plans
No.
behind the scenes. Do you think that there are enough physicists to actually support a role like this? Because obviously workforce challenges exist across the entire radiotherapy pathway.
Yeah, that's going to be a really important question, to see how many patients are interested. Um, uh, with the way that the research is set up, is patients will be invited, but only those who would actually want that appointment will end up asking to participate. So I'll get an idea of the number of patients who are interested. Um, this work has been inspired by some work that a physicist called Todd Atwood in San Diego has done, and there's been a lot of argument back and forth about the fact that we already have too much work, and it's going to be really difficult to sustain. The argument is that we've got artificial intelligence technologies coming in, we're reducing a lot of the manual work that we have to do, and yes, we've got to look after all of those technologies, but hopefully we'll be creating some extra time that instead of doing perhaps some of the other tasks we do, we look at being more patient-centred. I'm going to analyse how long these appointments take, the number of patients, to get an idea of if it is feasible. And it's certainly not something that I would advocate being in place for everybody. It very much needs to be another tool in the toolbox for patients who do want to know more.
Brilliant. Well, thank you so much, Charlie, for joining us.
Thank you very much.
And wish you all the best with your research.
Thank you.
Cheers.